This is a case of a ReSTOR multifocal lens with a cracked haptic. I have made the decision to remove this lens and exchange it with another ReSTOR multifocal lens. Here I am viscodissecting the capsular bag, checking the mobility of this lens. The anatomy seems to be excellent. There's the cracked haptic, as you can see here, and in higher magnification, right at that junction. I'm now maneuvering this lens out of the capsular bag, lifting it up so I can inject viscoelastic behind the lens to inflate the capsular bag. And here I am lifting the lens out and dialing it out of the bag safely so it can lie in the inferior position while I plan to inject another lens under it, and that's viscoelastic protecting the cornea. And some Provisc again to viscodissect the capsular bag and keep it inflated. So in this way I have sandwiched the lens with viscoelastic protecting the bag posteriorly and the cornea anteriorly. Here I am now injecting another ReSTOR multifocal lens under this lens into the capsular bag, maneuvering it gently so it goes under this lens and right into the bag. I'm now centering this lens, dialing it into position so it's into the capsular bag. I'm now checking to see under the iris that the lens we have inserted is nicely centered in the capsular bag and everything looks normal. I'm now maneuvering this lens that I want to remove, and I'm dialing it in the anterior chamber under viscoelastic. I now have the lens in a position that I could grab it. At this point I'm injecting viscoelastic under and above the lens. So once again I sandwich this lens to protect the cornea in front and the bag at the back. I'm now grabbing the cracked haptic. It actually breaks off. So I dial the lens to position the other normal haptic and hook it out at this point to use that as an anchor as I cut the lens in two. This lens is now retrieved through the same small incision without increasing the incision size. The viscoelastic is removed from the eye and we have a happy patient. In most cases of multifocal lens dissatisfaction, it is important to find the cause, which may be residual refractive error, anatomical, or even design elements, and address the same to return these patients to the best vision they deserve. Thank you.